Akaya Aka Jehovah Nemema Ọrụ ebube ya keneruari n'ebema isi ike ndụ kenadịghị atata aka ya aka Jehovah Nemema aka ya aka Jehovah Nemema ọrụ ebube ya keneruari n'ebema isi ike ndụ kenadịghị atata aka ya aka Jehovah Nemema oh Jehovah oh tajimileliwe ọgọrọ ya na wunala aka ya
Dr. Moses Omorogbee-Elizabeth, past medical director of the center. Please put your hands together for Dr. We also have in our midst head of the department of the internal medicine department, Central Hospital in the city. It's my honor and privilege also to recognize and invite the Please, let's put our hands together as we welcome her. We have this also, together, I know that we are okay here. We want to invite to the high table for Mr. Okebudia Ernest, as he takes a seat to the high table. Okay. A consultant, family physician, here in our midst. Ladies and gentlemen, please keep your hands here. Please, sir, thank you so much for coming. And also, we have in our midst also recognize in this occasion this afternoon for Dr. Osumbo. Please let's put our hands together for them. Educated and enlightened about all of the effects and everything we need to do to prevent stroke. Ladies and gentlemen, we have in our midst, and as hosts and chief speaker in this event, our very renowned chief consul. Yeah, I believe you. Thank you so much. At this point, we are now going to take an opening speech and Chief Executive of the Edo State Hospitals Management Board, here represented by
Dr. Abo-EEASAF, who is unavoidably absent. He is on an official assignment. We are here today to observe the World Stroke Day, which is an annual event that takes place on the 29th of October. And so, today is no different. This program has been put together in collaboration with the Hospital Management Board and the Medical Women Association of Nigeria by the Augustine, Bonaventure, Omorogbee-Elizabeth, Ekhator, and Stroke Awareness Foundation. And that is a mouthful, you might say. But that tells you how important this is.
I welcome you all to this World Stroke Day. I'm actually delighted to be here again to participate. Today I said I must be here. That's why I made time for it. I'm not there this morning. Thank you all and enjoy yourself and listen attentively to the resources that will talk to us this morning. Thank you very much for this.
Please, let's put our hands together for Dr. Olabisi as she gives some good witness.
21. I want to wish the Abo-EEASAF, is that how it's called? Yes, a brilliant program today, which I believe everybody will benefit from, and I pray it shall be well with all of us. Thank you.
Thank you so much, ma'am. We now call on Justice V. Eboreme for her goodwill message. Let's put our hands together.
Gentlemen, and special recognition and respect to those on the high table. I'm very interested in this topic, even though I'm not a health worker. But I'm really interested in it because we see people around working in a very funny way. Then when you ask what is the matter, they will tell you that the person just had a stroke. And there are many opinions on this. Me, being not a health worker, I'm really interested. And I wish that more publicity is given to this program, so that many more people will come to benefit from what we are about to be taught today. It is because of my interest in knowing about this matter, that is why I decided to honor this invitation. And not only that, you will discover that the traditional medical practitioners or native doctors, they will tell you that when you have stroke, this is what should happen. This is what you should do, you know. And at times, we that we are the recipients of those advices, we are confused. And their own is not tested. It's not, they just come up and lay claim to different things. So I think this is a very good opportunity for us to learn exactly what is happening. I read the material that was given to me as I was sitting there, and I was seeing some parameters with which you measure some of the things that indicate maybe a threat of stroke and all that. So I would really like to learn more, and I believe that all of us are here not only to honor our sister that has put this together, but also to learn, and we can spread the news, so that the next time this program is coming up again, we can also invite people. As I was sitting there, I was regretting that I didn't invite other people to come with me. So I believe that I will not make that mistake again. So, ladies and gentlemen, I wish us happy deliberations.
Put our hands together for him. Also in our midst is the head of Department of Engineering, State Hospitals Management Board, Edo State, Engineer Benjamin Ufwa. Welcome, sirs. Thank you so much for gracing this occasion. We will now hand over the microphone to the chairman of the Medical and Dental Consultants Association of Nigeria, State Hospitals Management Board branch, Dr. Ohehe Victor, to give his goodwill message.
Foundation has with M1 and HNB is something that should be related. The best way to recognize one's parents and carry on their legacy is to go beyond them. Instead of the feastings and the bursary that goes with celebrations, I think it's high time we begin to think inward and begin to do what will outlast us. If some of these our forebears from overseas have not left their shores, we will not have what we have now in terms of education, in terms of Christianity, and other things. So I must commend our very senior elder here, Dr. Mrs. Kayode-Iyasere, for this initiative. It takes enough time, enough effort, enough legwork to have this kind of crowd. I must tell you that even when MD Khan is doing such a thing, we don't just get to this crowd in less than 1 hour. But she has been able to pull everybody from all walks of life here to listen to something that is important. Yesterday we thought that cerebrovascular disease happens to the elderly, but we are now beginning to see that I have friends who are much older than that have come down with it. Our lifestyle have changed. The craze to make it on time and other things, the risk is real. The danger is real. It does not matter if you are slim as a broom, you could have risk, because it's not just obesity, there are other risk factors. And so this is very important, because health is wealth. And I want to say that everyone should pass on the message that we should become brand ambassador. We can fight it. Just now, cervical cancer is no longer a threat in the developed world. Why? Because screening exercises have been put in place, sponsored by government and non-governmental agencies. And I believe going forward, to avoid cerebrovascular accidents or stroke, we can collaborate more. We have politicians, those that have the means to collaborate more with this foundation to carry this message, not just to this circle, but outside the regular space, down to the villages. We can beat it if we all come together. Once more, thank you and welcome.
In protocol, I want to use this medium to thank our big sister, our mother indeed, who with the foundation put this together. Since this foundation started, I think I have followed very closely, and sometimes I look forward to a day like this to learn again. And I want to welcome all of us once again to learn. One thing that I have discovered is that the day we stop learning, that is the day someone starts dying. So opportunity for us to learn and know about this stroke, knowing fully well that we can prevent and treat the disease. So I want us to sit back and enjoy these lectures and the day. I also pray that the Lord Himself will strengthen our sister and the foundation continuously, bringing us together every time. And we are praying that next time this is going to take place, personally I have done my own best or my own bit this time around, but I promise you, man, that if there's going to be a next time for this program, I will do more for the publicity. God bless you all in the name of Jesus.
To please take their seats back with us as we listen to these lectures. I've discovered that we are not clapping much this morning. It's okay. There's this small, before the lecture starts, there's this. If you are happy and you know it, say amen. Amen. If you're happy and you know it and you really want to show it that you're happy and you know it, say amen. Amen. You know this song that I'm singing now, they used to punish me for this song because there's a question. people can sing this song. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it and you really want to show it that you're happy and you know it, clap your hands. If you're happy and you know it, tap your feet. If you're happy and you know it, tap your feet. If you're happy and you know it and you really want to show it that you're happy and you know it, tap your feet. If you're happy and you know it, do the 3. You see confusion? See, people, you see? This thing, my mom will give you more. I use straight this emoji. Adults now are feeling this emoji. Let's try it again one more time. If you're happy and you know it, do the 3. Some people think happy before they say amen. Let's try it again. If you're happy and you know it, do the 3. If you're happy and you know it, and you really want to show it that you're happy and you know it, do the 3. Let's put your hands together. God bless you. This morning we have this lecture this afternoon, Dr. Osereme Osumbo. Please, let's put our hands together.
Let me permit me to stand on already established. I cannot go ahead with this lecture without first acknowledging my order in academics and in the department of is a consultant, a very senior or chief consultant neurologist. I actually am the least person to stroke patients over decades, running probably to 30 decades or more. And I'm just a very young physician who probably has not managed up to as many stroke patients as she has. But she has given me this very great honor and privilege this day to do this lecture. I do not take this opportunity for granted, ma'am. I appreciate you, ma'am. Thank you so much. Now, we'll be looking at stroke this morning. Stroke means many things to different persons. Next slide. I want to indulge us not to be asleep while this lecture is going on. Please do not sleep so that you don't start saying things. Excellent. Now, stroke is also known as cerebrovascular disease in the past, but that has changed now to cerebrovascular disease, and it also refers to as a brain attack. Now, I decided to bring this out, the mark of the beast 666, which we see in the book of Revelation chapter 13 verse 18. And why the mark of the beast 666? As at the year 2012, this was a statistics I was giving about stroke burden the world over by the WHO. And what was this statistics? That 1 in every 6 individuals develop stroke in his or her lifetime. And that the lifetime risk of stroke is even more for women, and that is 1 in every 5 women. Whereas for men, it's 1 in 6, as at that time. And that every 6 patients develop stroke every minute. Even though now, it has even gotten worse. That as at then, it used to be 6, but now it's even 4. Every 4 patients develop stroke every 1 minute. And as at then, every 6 hours, 1 death is recorded in favor of stroke. And then as at 2012, 6 million deaths are recorded worldwide of patients who die from stroke. And this number has risen to as high as 15 million deaths worldwide. So you can see the enormosity of the burden of stroke the world over. Now, what are the historical remarks or landmarks about stroke? Hippocrates, who is one of the very forefathers of medicine, discovered or first described the phenomenon of sudden paralysis. And in Greek, that was referred to as apoplexy, which also means something happening sudden or to be struck by violence. And then other people have tried to explain the meaning of stroke to mean for somebody to have a spiritual attack. Even you and I will agree with me that in our environment, when people have stroke, they will say they have a spiritual attack. As a matter of fact, most persons believe that stroke is a spiritual attack and it must first be presented at either a spiritualist home, like maybe churches, or even mosques, or even the traditional medical healers before coming to the hospital. And that is still the trend that we find today. Next block before you move on. Now, some other people have attributed it to the witch theory. When somebody, because the way it happens is usually very sudden. Sometimes you might even be asleep, and in an attempt to wake up during sleep or during the middle of the night to go and ease yourself, the individual suddenly notice that one hand and one leg cannot be moved. And for that, some persons have attributed it to a spiritual attack or to a witch attack or a wizard attack. Or some people will even say, it's not my wicked mother-in-law that has caused this, especially if there was a precedent. Maybe there was a quarrel before the attack. And so they are very quick to tie it to that quarrel and say, no, he really said he will deal with me. So he has dealt with me now. And that is why I'm having this attack. But as we continue in this discourse this morning, we shall begin to see that it is not actually spiritual attack. Because people don't have knowledge, that's when they say this is spiritual attack. Some other people have attributed to as a result of offending the gods. They say, probably I've done something bad. So his payback time, his nemesis is catching up with him or her. Next slide. Now, what is the burden of stroke? Stroke has burden on both the economy, it has social burden, it has public health burden, even medical burdens. If you go to our medical world now, I can assure you that you will see nothing less than 2 or 3 more stroke patients in that world. And many of them usually stay longer in the world. Of course, somebody who cannot walk or talk sometimes, you may not want to discharge him or her. Even the relative will tell you, they never walk now, why you want to discharge them? And as a matter of fact, when they also get home, they are probably not able to help themselves. They are probably not able to walk around, not able to sometimes talk. And so these are burdens placed on families, economic burdens. Sometimes when you even want to get these persons to the hospital, I've seen patients who will tell you, they can't come to the hospital because they have to probably hire a car to bring the patient to the hospital for follow-up. You can imagine the financial burden that stroke condition will be placed on the family. And then, with lots of productivity and bodies of family, caregiver, and society, of course, I've seen patients who suffer stroke and for months they are not able to go back to their regular job. Sometimes their job involves writing, and these are persons who probably are right-handed. And as a result of the stroke, they can no longer write. Sometimes they are teachers that need to use their hand to write on the blackboard. And as a result of the stroke, they can no longer do all this. So these are burdens that stroke have placed on the economy, on the society. And it goes a long way to even affect the individual's daily living. And stroke has been seen as a second leading cause of preventable death. You see, that's highlighted in red. It's a preventable death in adults worldwide. So why allow us suffer from deaths that we have prevented? And it has attracted global attention. Both major public health issues, international collaboration activities are also sought after or required, like what our mama is doing today. These are advocacies, public enlightenment, which is not readily seen, which is not readily done. But she has taken it upon herself with this foundation to do this year, just like our former MDs told us earlier in his speech that last year we were all at the golf course exercising it out, and I also, for one, will never forget that experience. And these are things we are supposed to be doing regularly. Now, how do we define stroke? As at 1970, WHO gave us this definition of stroke, which over the years have been improved upon. And what was this definition? That it is a focal or global cerebral dysfunction of vascular origin lasting more than 24 hours or leading to death. Now, there's only a little change that has been made to that definition, and one of those changes that have been made is that it is no longer considered as a global condition, but focal, involving one aspect of the brain. And for some of us who are already in medical field, we know that the brain is divided into two hemispheres, one on the right and the other on the left. And the one on the left controls the right side of the body, and the one on the right controls the left side of the body. So for anybody who suffers a stroke involving one focal hemisphere, such individual will likely develop deficits or weakness on the other side of the body, most times the upper hand and the lower leg. Now, there are different types of stroke. Basically, there are three main types of stroke. The one we call the cerebral ischemic stroke, we have the intracerebral hemorrhagic stroke, and then of course the subarachnoid hemorrhage. Now, what that means, for the sake of those of us who are not medically inclined here, there are stroke that we refer to as stroke as a result of a clot of blood. Those are the ones we refer to as ischemic stroke. Whereas there is others that are due to bleed in the brain. Where there is a bleed, obvious bleed in the brain, that's the one we call hemorrhagic stroke. Basically, these are the two broad types of stroke. But there are other subtypes of stroke, sometimes depending on the location in the brain, and sometimes depending on the kind of blood vessels, as the vessels that carries blood in the brain that is involved in this stroke. Because some people will have a stroke and they go to do a brain scan, and the scan may look normal, but that does not mean that the individual has not suffered a stroke. Next slide. Now, these are just the things you see most times on the CT scan, the brain scan, that an individual is meant to do whenever he or she suffers a stroke. Now, you see this one here, a little darker. That one is the one we refer to as an ischemic kind of stroke. Whereas the one at the middle, you can see some white things. All these ones. You see that one there? This one is a bleed. This one is a bleed. Anyone that looks like the bone covering of the brain is one we really refer to as a bleed. You can touch another bleed too. Now, these are the kind of things I will see many times when we ask people to go and do brain scan. And that is one of the very notorious risk factors for hypertension. The next one is DM, which is diabetes mellitus. Often the times when people have hypertension, over time they begin to also develop DM because they are like twin brothers. Sometimes it might even be as a result of drugs that they are being used to take up the hypertension that is leading them into having diabetes. So many times we find patients having both. So when you have both, that is a double risk factor for developing stroke. Other risk factors that are known is dyslipidemia. Dyslipidemia is abnormal lipids or abnormal fats in our body. Of course, we have fats in our body. It might not be obvious by our physique. Until you check the value, you will not know how high or how low or how normal your fat level is in your blood. Just the same way your blood sugar. Until you check the value, you may not know how high or how low or how normal your blood sugar is. The same goes for obesity. Of course, obesity is what people always look out for. They say, the way you fat, people like say your cholesterol is high. It doesn't always follow. So until again you check, you may not be correct. Even obesity, many times, until you check your weight you may not know whether you are obese or not. And there are many people over the year out, they don't check their weight. They don't know whether they are adding or whether they are just static. You understand? So these are values that we ought to be checking from time to time. And in other times, some persons will have literally all these things together. They have hypertension, they have diabetes, they have dyslipidemia, and they are obese. And that is what we refer to as metabolic syndrome. And it's a very strong risk factor for stroke. So the more of this the individual has, the more the risk he or she may develop stroke. Then of course, age. Studies or researches have shown that the age bracket between which you find many people suffering stroke in our environment are usually between the ages of 50 and 59. And that is why it is wisdom that the moment you clock 50, you should begin to be careful about what you eat, what you drink, and more frequently taking these your values. Your values of blood pressure, your values of blood sugar, your values of lipids, your cholesterol in your body, and all that. So, but by and large, stroke is commoner as one advances in age. In the past, people used to say, when people are already getting to 70-something, 80-something, that is when they suffer stroke. But it's not that so. As we continue in this discussion, we shall soon see that there are an entity we refer to as stroke in the young. We now even find stroke in patients who are very young as 15 years of age. And we shall see why they suffer stroke at that age. And of course, there's what we refer to as transient ischemic attack. That used to be what people would say, I had what looks like a partial stroke. Suddenly I noticed that one part of my body was weak. And within 24 hours, the thing disappeared. There's not a partial stroke anymore. The moment you experience weakness of your arm or difficulty in your speech, whether it stays up to 24 hours or less, you have suffered a stroke. We must call it what it is. Before they used to beg it and say it's a transient problem, and people don't take it seriously anymore, or as a then. But now, whether it is transient or not, as long as you notice weakness on one side of the body or other features that we shall soon see that are attributable to stroke, the individual has suffered a stroke. Now, there are other risk factors that are also known. People who have PCV that is very high. PCV that is very high is considered to be PCV that is above 55%. 55 to 60%. PCV of 48% is not high. I've heard people or patients say that they did PCV and they said my PCV was 45% and they said it's too high. I should go and donate blood. You are not donating blood because you have a PCV of 45 and it's too high. No. Normally it is a good thing to donate blood once in a while. But the PCV that we consider high, that can predispose an individual to stroke, is a PCV that is as high as 55 and above. And that is what we refer to as polycythemia. Then people who have sickle cell disease, their genotype is SS. And sometimes even those that have S gene, AS, they have also been seen to be at risk of stroke. And these are people who, for knowing that they are sicklers or they have SG, are supposed to be going for frequent monitoring, especially of all these other things that we know, like the blood pressure, blood sugar, cholesterol level that we have earlier talked about. Now, what about contraceptive use? Some persons may not have been diabetic, they may not have been hypertensive, but because they have probably completed their family side and they're taken into contraception, maybe oral contraceptive or even injectable contraceptive. And these have been known to be risk factors for stroke. So if you are into contraception, whether oral or injectable form of contraception, it is advisable that from time to time, you check your blood pressure, you check your blood sugar, because all these things are not standalone risk. Many times, they are one or more risk factors that are put together that predisposes the individual to having a stroke. Now, other risk factors are hormonal replacement therapy, especially for those who are quite old and they are suffering having some form of pain or bone pains and all that. And so they are having maybe to replace their hormones, especially post-menopausal women. That also predisposes them to having a stroke. And peripheral vascular disease, aortic stenosis, heart disease. You hear some people will tell you that once in a while they hear that their heart is skipping, or they hear their heart beating irregularly. When you sleep and you hear your heart beating irregularly, it's an indication that you should go and see a doctor. More importantly, a cardiologist, so that they examine your heart. Your blood pressure will not be high, but your heart is already telling you that there is a problem here. You sleep, you hear your heart beating, sometimes you hear some misbeat or skipping. That may just be a deadly sign for atrial fibrillation, and that thing I talked to you about stroke in the young. People have asked me many times, this man is just 15 years, how come he's having a stroke? This one is just 20 years, how come he's having a stroke? These are not stroke. They suffer the bleeding kind of stroke, which usually carries a higher prognosis. That means many times when they suffer that, they die from it. Now, migraine has been attributable as one of such things that can cause stroke in the young. Heroin, many nowadays we see our young people indulging in all forms of substance abuse, drugs, illicit drugs like cocaine, methamphetamine, marijuana, contraceptives among the young ladies, the need to prevent pregnancies, and all that are make them to become of higher risk of stroke incidents. There are other ones that kind of spread also talk about. I must mention HIV. You see that commonly among very sexually active young men and women, and that also can predispose them to having stroke. Next slide, let me not talk about this. Now, there is a stroke risk score that I think we need to know. And what is in this risk score are basically some of those things that we have mentioned that we can change. Like our blood pressure, okay, so if you have the different it's the pass around our so take time out to look at them, and then you will know whether you are in the danger zone, which is the red zone. Your blood pressure, your cholesterol, your diabetes status is not, you don't have, whether you smoke or not, whether your heart beats irregularly, or whether your diet is making you overweight or normal weight, or whether you do exercise. All that, if you are in the green zone, that means you are probably free from developing stroke. So let's get home and look at those leaflets again. Next slide. Now, how do we recognize whether somebody has stroke or not? It depends on the location and the extent. Next slide. Next slide. Now, this is very important. Again, it's on your leaflet. Now, the way you know whether somebody has stroke or not, and what we have just represented on this slide, the facial weakness. When somebody, even many a time patient or relatives are the ones that will tell you, we suddenly notice that the mouth has bent to one side, or the mouth is no longer working on one side, or arm weakness. As in, if you raise your arm, you can't raise the hand. Raise your leg, you can't raise the leg. On one side, you know this one probably has survived the stroke. Sometimes the speech, the person was giving a talk. I've seen ministers of God in the course of preaching, giving sermon, they suddenly slump. And just see them going down like that. And by the time you check their blood pressure, very high. No time to check blood pressure. So it might be during delivering a speech, and suddenly the person can no longer talk. You understand? And the thing about stroke is that it's all dependent on time. It happens suddenly, and so it must be attended to suddenly, as prompt as possible. Not time to be going to a spiritualist room or a native doctor before coming to the hospital. By the time you get to the hospital, maybe the damage they have done. Next slide. So we must act fast. We must act fast whenever any person suffers stroke. Next slide. Next slide. Next slide. So now this is actually for academic purpose, to know whether it is the one that is the bleeding stroke or whether it is the one that is the clot type of stroke. Next slide. Next slide. Now, okay. before this one. If you do have a stroke, you must act fast. You must not hesitate. It's not time to be moving around looking for somebody who will put mark on the hand and the leg. I've seen that many people do that a lot. So we say, put the leg in the fire, hit it very well. When you start moving the leg, when the fire is very high, then you remove the leg and then you know that you have responded. No, it's neck that is involved. It's not the leg. The leg is no hard problem. It's the brain. That there is a brain attack, and the brain controls the leg. The brain controls the speech. The problem is not in the speech, it's in the brain. So if you must treat stroke, then treat the problem in the brain, or control what causes the brain to have an attack, which are what we have already talked about. Next slide. So it's a brain attack. And so it describes the active presentation of stroke, emphasizing the need for urgent action. Next slide. So the brain, why is it important that we must take care of the brain? It is because 200 million neurons are in the brain. And once a neuron dies, it cannot be regenerated. 2 million neurons die every minute. Brain is brain, and it's the key concept. 2 million neurons lost per minute. Age of 3.6 years per hour or by pulse. So when there's no enough blood supply, no enough oxygenation to the brain, as a result of the attack that are taking place, as a result of the bleed or the clot in the brain, those neurons they die. And the earlier you salvage them, the better. So the message here is that anybody who suffers a stroke, it's not the hand and the leg that is weak that is the issue. The issue is in the brain. So to want to be looking for a native doctor that will put mark on the leg and the hand is a waste of time. Or putting the leg and the hand on fire is a waste of time. The problem is in the brain. And that is why we present early. There are only hours of presentation. We present early and treatment is instituted earlier on. Many a time, the same person who came with one leg weak, you see him walk away using the hand and the leg. Why? Because early presentation. So presentation is very key. What is the roadmap? The roadmap is that first you must recognize that this is a stroke. You must recognize that, and once you recognize, you must act immediately, react immediately by ambulance services. I think very soon we'll get there, especially with the way the government is going today. Very soon we'll start having paramedics in the streets. You can call the number 911 and you hear 111, and they come and carry the man or the woman with a stroke and take to the first class, 5-star hospital that we shall soon build in Edo State. So the response must be emergent. There must be emergency department. So the moment the patient comes, they move the patient into the emergency unit, and before you know it, the care is instituted immediately. And of course, you must quickly do a CT scan. It's not that when the patient comes, that is the time to start looking for money or to start calling family meeting. You don't get stroke. Let's raise money to do CT scan of about 36,000 naira, which we always see here. And by the time they are gathering money, 1 week has passed. You don't even know what kind of stroke the patient has. But I'm sure very soon we'll get to the stage in our country when CT scan, as the patient is coming, are willing or high to the place and they are doing CT scan without asking to pay the dime. And then of course, treatment must be instituted immediately. And of course, there must be rehabilitation. One of the things about stroke management, apart from attending to the brain, is also to rehabilitate that part of the body that is affected. Now, how do we prevent stroke? Essentially, the message here is prevention. We have said that stroke is preventable. And so, how do we prevent it? Preventing it is simply adjusting all the lifestyle and prevention. If your blood pressure is high, get to see a doctor, let them check your blood pressure. And if it is high, you start treatment. And I don't know what is sinful about using drugs to control your blood pressure. I hear people say that, you go and throw away that antihypertensive that they gave me in the hospital. Sell your car, don't use it anymore. Use faith. And even faith say, if you don't add drugs, it becomes dead. So, if your blood pressure is high, you must reduce it. And when you reduce it, you have reduced the risk of stroke by about 40%. If you are smoking, you must stop smoking. If you drink alcohol, you should be discouraged so that your triglyceride and LDL can get better. And of course, if you are diabetic, it must be controlled. And then, of course, you must maintain an ideal weight. Regular exercises also is key. Next slide. Then, cholesterol drop and all that is also important. Now, I'll just keep this. It's part of what I'm already talking about. Next slide. Okay, like IT age, even native doctors now use computer to tell you the weakness is on one side. Yes, so they now use computer. They no longer throw calories on the ground. So how do we treat stroke patients? The goal of treatment is to ensure that the brain is well perfused. Remember I mentioned earlier that stroke is a brain attack. Yes, and less emphasis must be on the deficit, especially when the patient presents early, as early as within 24 hours. So that's where you see us put up infusion drip to perfuse the brain, rehydrate the individual. That's where you see us in develop one, they give drugs that can quickly go and attack the clots, dissolve it, so that the weakness on that side can become normal. So protect the ischemic brain tissue from necrosis, attempt to reverse or limit the degree of brain dysfunction. And of course, treat underlying diseases, which is what we're emphasizing here today, of treating the preventable risk factor. Those are the underlying diseases. Then, of course, prevent and treat complications. For someone who is going to be on the bed, not able to use hand, use leg, you must ensure that it doesn't start developing sore on that side. You understand? If he is not able to use the mouth to talk, you must initiate some form of speech therapy so that over time the person will begin to talk. So there must be some form of rehabilitation for that individual. And all these are done in the hospital, not in the native doctor's home. Next slide. Next slide. So these are what I've mentioned: thrombolytic therapy, early anti-thrombotic treatment, treatment of elevated intracranial pressure. All these we do in the hospital. But I hear people say, then we will not get stroke medicine. People in our hospital here, if you see patient, they will come, have a stroke, the family will gather, they will come like another day and tell you, doctor, we want to come on, we want to start. And why? They tell you, they say they don't get medicine for stroke, for hospital. And you see, they will carry the patient to one native doctor who will start using mark, the result and other things to mark the leg. And many a time, we deteriorate and remember again that, let's go to the hospital so that you go and die in the hospital. You understand? So, that is why we must have this lecture and also carry it to our various homes to let them know that there is medicine for stroke. The medicine just now may not be the one that will make the person to start walking immediately, but to also prevent further stroke and to also perfuse the part of the brain that is also already damaged. And those are some of the things that we do in the hospital. Next slide. So, I think I thought today was Monday, so I didn't know today was Friday, but I have to say, thank God it's Friday. So thank you very much for listening.
Thank you very much, sir. Please, we can do better than that. Let's put our hands together again for our very excellent speaker this afternoon. Thank you so much, sir. Sir, please, you may take your seats. We'll ask questions. So please, let's just pen them down. After the next lecture, we'll ask questions. But while Dr. Sumbo was still speaking, the immediate past Commissioner of Health, Edo State, just walked in. Ladies and gentlemen, please, let's put our hands together for our very welcome senior colleague, Dr. Patrick Okonkwo. You're welcome, sir. Dr. Mrs. Okonkwo. You're welcome. At this point, we are continuing here, hosts and senior colleague who is a mentor to a lot of us, the Chief Consultant Board, the State Hospitals Management Board, Dr. Edith Kayode-Iyasere. Please let's put our hands together.
Thank you. Dr. Sumbo, thank you very much. Maybe a little bit of academics there, but I will get in more on the practical aspects. What you and I must do, putting all your head into practice. This is what my talk is all about. Stroke awareness program. Okay, briefly let me talk about the Abo-EEASAF Stroke Awareness Foundation. Abo represents Augustine, Bonaventure, Omorogbee, and EEA represents Elizabeth, Ekhator, and Abo, Augustine, Bonaventure, Omorogbee was my father, while EEA, Elizabeth, Ekhator, and was my grandmother. They both died of stroke 32 and 43 years ago. So when we were doing the anniversary 2 years ago, the family came together and said we should put up a foundation where we can talk about stroke. Because just like you have heard, stroke is preventing, and that was 2019. Like you also heard, last year we did a dance at the golf course because the World Stroke Organization told us we should do dancing as a form of exercise. If you listen to Dr. Sugo very well, talk about lack of exercise. And dancing is one of the exercises we must do to prevent stroke, and we did that last year. And this year again we are here. Just like some people have imagined, it could have been bigger. But for reasons beyond my own control, one has been very busy doing this and doing that. I just felt I should put this together for the board, Central Hospital, and some people outside here to come and listen to mark the day. Please listen attentively. Like I said, this is the practical aspect that you and I must do. Thank you. To know is not to feel. What does that mean? We are told that knowledge is power. And the Word of God tells us, my people perish for lack of knowledge. I've been on the field for so many years, distributing leaflets. In fact, you have 3 leaflets on you, and you have for stroke, you have for cervical cancer, you have for breast cancer. And today we happen to be the cancer month, where we can also talk about breast cancer and cervical cancer, especially for our women. And as you know, as a medical doctor, I'm also a medical woman. And we have our association, the Medical Women Association of Nigeria, where our main focus is breast cancer and cervical cancer. And we do it from time to time. And on the field, giving leaflets to people. Some people have expressed fear. Doctor, I don't want to receive this paper from now. They put fear for somebody. No. To fear is not to know. This pamphlet was given to us in Australia about 20 years ago. So when I've been traveling and taking stuff that are beneficial to our people. Next slide, please. So we've been told stroke is preventable. We have also been told stroke is treatable. You heard from Dr. Sugo that 1 in 6 people worldwide would have a stroke. There, that was the thing. That was October 29, 2010. That was 11 years ago when we were on this campaign. 1 in 6 people will have a stroke. And they said that it could be you. It will not be you in Jesus' name. And that is why we are here. But today we are talking about 1 in 4 people. And we are saying, don't be the one. Don't be the one. Next slide. Next slide. We've heard about what stroke is. It is a brain attack. And we've heard that vessels are blocked or a vessel rupture. Either way, the stroke will occur. Where is this vessel located? In the brain. We emphasize that it's not about putting marks on the body. The problem is in the brain. That a vessel to the brain is blocked or a vessel ruptures. And when that happens, the stroke has taken place. Go on. And these vessels, they carry food to the brain, oxygen and nutrients. And so when the vessel blocks or occurs, that means the brain is starved of this nutrient. And that is why that leg or that hand can no longer move. Go on. So we heard from him too that there are types of stroke. We have the ischemic and we have the hemorrhagic. What is the difference? Next slide. That's a presentation there. That's ischemic stroke. I don't have, sorry, I don't have my pointer, but if I could. You see that shadow there? Okay, you have it there. That's the blood vessel. That's the blood vessel. And you can see what happens at the other side. The one in the best see, that thing portion, exactly. So that shows that that part of the brain is starved of nutrient, of blood. That is a dead tissue in the brain that supplies that hand and leg that can no longer move. Then on the slide, back to the hemorrhagic stroke. That is a vessel. That is the burst vessel. When that happens, blood spills all over the brain. You can just imagine a blood vessel in the brain. Blood spilling all over the brain. Can that person survive? Do you expect that person to survive? That is the hemorrhagic stroke, that is a very bad one. And that is what is represented on the other side. These are other representation. So what made these two significant? The first one, that the blood vessel is blocked. A patient can go to bed, watching television with the family and all, maybe you're waking up in the morning, the hand and leg can no longer move. But the person observed that the mat is easily twisted to one side. He can tell the story. So when the speech is not taken, that same patient can tell you this is what happened. This is ischemic type, and about 80 to 85% of patients suffer from this. Whereas the hemorrhagic one, which constitutes about 10 to 15%, when it happens, most times the people are brought in unconscious. That is the effect of a bleed in the brain. Next slide. So we had also talk about risk factors, uncontrollable and controllable. Dr. Khan, please, if there are still people in the other place, they can still find seats. Let them come in. Please let them come in. I know some people will not there. Let them come in, please. They can find seats here. What about uncontrollable? There is nothing we can do about it. Age. I've told this story each time I keep telling it each time I give a public lecture. Is age controllable or uncontrollable? It's supposed to be uncontrollable. But people declaring official ages, isn't it? Once upon a time I ran a clinic and there was an elderly man before me. But when I looked at the case note, it was showing 50 years. And I said, how old are you? He said, oh, you know, with my cooking. I am 75 years old. Official age, but like our first speaker said, we don't utter what the body really is. So also gender, I also mentioned transgender. We now have people becoming male, whereas they were female, whereas they were male, but it does not utter what God has given us. Then race, multiple nationalities, family history, previous stroke. In the beginning, the word of God says it was not so. So we stick to what is in the beginning. So those are the uncontrollable risk factors. There is nothing we can do about them. But the controllable ones, those are the ones we can do something about. And that's why we say stroke is preventable. If you do something about these ones, stroke is preventable. The first thing we'll talk about then is know your blood pressure. There's what we call a traffication. I will elaborate on that. If you smoke, if you drink, with high cholesterol movement, diabetes, exercise, low sodium, weight reduction, no symptoms of stroke. Go on, because we are already spoken about them. High blood pressure is a major risk factor for stroke. All over the world. All over, not about this part of the world or that part of the world. All over the world, high blood pressure is a risk factor for stroke. If you are 40 and above, you mentioned 50, but I'm taking it to 40. If you are 40 and above, and look, some of us are 40 and above here, you must have your blood pressure checked every year. But if you have a family history, so like I just told you, having a grandmother and a father that died of stroke, they were both hypertensive, they were diabetic, they were overweight. So that shows there is a family history. So if you have a family history, you can check your blood pressure every 6 months. Next slide. But next slide talks about even checking it more often. That to say, every citizen should have their blood pressure checked by healthcare provider at least 4 times. You can check it more often. And what I'm advising here today, we have instruments for checking blood pressure. Very simple ones you can easily do for yourself. Easily to check it. I know there are issues with that because I've had patients. Every day they are taking their blood pressure. Every minute they are taking their blood pressure. That is not what we are advocating here. Normal blood pressure should not be more than 130/80. Maybe exceeding this must be reported to the medical practitioner for proper check-up. If you are hypertensive, talk to your doctor. Your doctor may recommend some drugs. Changes in your diet and recommend some drug changes in your diet and advice on regular exercise. I highlighted that please take your drugs regularly and be regular with your clinic visits. A lot of people don't take their drugs because they are saying, doctor, am I going to be taking drugs every day of my life? That is the question on ground. And I said, do you eat every day? That is the question, baby. Do you eat every day? And the answer is yes. Make this one your second food. Or even make it more important than your food. But there are some drugs you cannot take without eating. I advise the men, before you give money to your wife, make sure you have separated your money for your drugs. It's as serious as that. It is to be taken every day until God intervenes. And you hear it clearly. Don't take those drugs. But this is where I have problem with church people. I'll be talking to them on Sunday in my church, by special grace of God. They spiritualize everything. But God has given us this knowledge, and we must put it into practice. Take your drugs. Come to the clinic when you are told to come to the clinic. Don't take your drugs when you are about going to see the doctor. Some people will start taking their drugs 1 or 2 days to the clinic, they start. So that when the doctor asks them, have you been taking your drugs, they can say, yes. Who are you deceiving? It's your health. You don't have to do that. Take your drugs, it is very important. And some people also specialize. Like I said, those who have their instrument at home. When they take the blood pressure and it goes up, they take their drugs. When it comes down, they stop. We don't manage BP like that. Please, we don't manage BP like that. Take your drugs. Obey the rules. Use those drugs and want to stop it if need be. I've had to stop 1 or 2 persons, giving them, even when I stop, I still tell them come for regular clinic visits. I'm still monitoring. And first of all, the BP begins to go up again, and at that point you intervene. So even if you notice that your BP is low, let the doctor be one to decide whether to reduce those drugs or to tell you to stop. Don't do it on your own, because a lot of people are taking unawares. This high, low, and by the time the blood pressure goes up, a stroke comes up. And you say they'll be taking their drugs, you will not be taking it. You'll be doing it your own way, the way that seems right to you. That's what the word of God says. Hypertension is a silent killer without symptoms. A lot of us here now are hypertensive taking drugs. We don't know. That's what we mean by silent killer. Does not announce himself. Some people have told me, but I see the way you tell them even better, say, but I see the work now, the thing never be like that. Say, I'm the one addressing this BP. By the time it comes down on you, you regret not obeying what I'm telling you now. By the time BP begins to give you problems, it's already telling you there are complications like stroke. Stroke is a complication of high BP. It's aftermath of high BP. Just like heart failure. The heart failure can also occur suddenly. When your leg begins to swell and you have high BP, that's already a complication. But we are saying we can avoid all of that by obeying the rules. If you are hypertensive, take your drugs. If you are hypertensive, see your doctor. If you are hypertensive, please go for your regular clinic checkup. Thank God this is an hospital environment. You know us. We are here. I am here. Dr. Sumbo is here. Dr. Ebe is here. The residents are here. Dr. Sayende, all of us are here. The physicians. You can easily walk up to us. Nobody should be ashamed of ill health. We are all exposed. We are all vulnerable. But there's something we can do to avoid all of this. Next slide, please. Talking about hypertension in the young, like talking about stroke in the young. Even young people are not scared. All of us are involved. So this talk is for all of us. And then what we call atrial fibrillation, when you palpate your pulse. Can anyone put their hand on the right shoulder? You already know what to do. You will feel something hitting your hand there. Do you feel it? Yes. It should be regular. It comes up at regular interval. Justice, are you feeling it? Exactly. So it comes up at regular interval. But when it becomes irregular, that means it's not coordinated, you are not feeling it regularly, it means there's already a problem. And that again can be a risk factor for stroke. So when you notice that, it is time to see your doctor. Next slide. Smoking, we learned about that. If you smoke, stop. If you don't smoke, don't start. Don't start. Smoking is not only a risk factor for stroke, it's a risk factor for a lot of diseases in the body. Name it. A lot of young people still smoke. Not just smoking, but the hard ones, cocaine, marijuana, all of that. All of these are all health risk. So also alcohol, do so in moderation. But I would say don't start. I know when we go to parties, we all organize our own to little alcohol, and some people have said, take a little alcohol for your stomach. Or no, the Bible says, take a little alcohol for your stomach's sake. Some people have taken it up on that. And I say, at that time, did you have any stomach ache? At that time, you were taking the alcohol, you had the stomach ache. So, honestly, medicine, which stomach ache do we take alcohol for? I can't even remember any, but I know there is in neurology, DET, then etc. treble, that could be one of the things we use to assess that disease entity. But we don't even prescribe it. So please, if you take alcohol, take so in moderation. And some also say alcohol is good for your heart. A little red wine for your heart. Again, it's not a license. It is not for a heart that is already compromised by hypertension and other risk factors. Even the cardiologist will tell you that. Don't take that red wine. Please tell me have some quiet. Let me see what we are doing quiet. So, a little alcohol, red wine for your heart, is not good for a heart that is already compromised by hypertension. Like I said, if you really go into the history of hypertension, we get 1 in 3 adults, 1 in 5 adults, 40 years and above are hypertensive. So if you count the adults here 40 years and above, 1 in 3 is already hypertensive. So taking alcohol does not really arise. Can we move on, please? Cholesterol, you have emphasized that. If you have a high cholesterol, also tend to see the doctor. I God's grace to be doing our medical outreach, on doing BP, blood sugar, and all of the things we need to check. That's the value there, and you also have that leaflet. Please go through it as you carry out your own check. Make sure the values that are being quoted were within the low range that he emphasized. Next slide. Diabetes, that's another big entity with us in Nigeria. Blood pressure, diabetes mellitus. A lot of adults also have high blood sugar. High blood sugar is the same preaching. If you know your blood sugar is high, take your drug. This is another disease entity, you must take your drug every day. Every day. Don't go to the Chinese people that use machine or whatever. I've had patients. They will come. I had one that only God delivered him. He was attending the clinic and we didn't see him again. And by the time I was seeing him again, blood sugar has got very, very high. Hey, Joe, where have you been? They took us to somewhere where they were using machine to do our bodies and all that. Computer. You know. Please take your drugs and obey the doctor. But I don't also like to listen to other people, except what the doctor is telling you. Not two individuals are the same, even twins. That this person has diabetes, I have diabetes, doesn't mean what is good for him is good for me. So you must also bear that in mind. They will just tell you, now this one I take. You two come and take this one. No, there are doctors around. When they talk to you, listen. Don't go and do it your own way. And people should do it their own way because they think it is cheaper and simpler for them to do. So they just obey. A lot of people don't like coming to the hospital. They are looking at the waka, spending a whole day. But we are here. That puts you at an advantage. So you don't have any reason to do it otherwise. Like my first speaker said, people have a stroke and you see them go to the native doctor and put in a mask. It has happened among us. Doctors do the same thing. Why should that be? Putting masks, and by the time we're saying we are alarmed, say, you did this. And that is, we'll talk more when we talk about time is break. Go ahead. So if you are diabetic, the value is also there. Make sure you do your blood sugar, and make sure you, when they use weight control, the drugs that are given to you could be both oral or injectables. Then your lifestyle, right? Gone are the days when we used to say diabetes should eat beans, plantain, endocrinologist is here, maybe during question and answer time to say a word or two. We no longer say that. We don't send them to go to a life of beans and plantain anymore. I think what we are concerned about now is the quantity of food, the quantity that you should reduce this, reduce that. But you can eat everything, so to say, but that doesn't mean you can take a bottle of Coke and just go, because even as a dad, you have the wisdom enough not to eat a high carbohydrate diet as you are doing that. You know, you'll be so hungry and that is what is available. Of course, you can do that to replenish yourself, but we also want you to have low blood sugar, which is equally very dangerous to the brain. So if you are on drugs, take it regularly and maintain a regular clinic attendance. We cannot emphasize that enough. Go ahead. Exercise. These are the various exercises you can do. How many of us are really exercising? Let's be honest. Take time out every morning. Maybe wake up 5, wake up 6. Some people do it. I have a sister who is so regular on that. Every Friday she has woken up and she's doing that. I don't wake up every Friday, but I do my exercises. I do. Because I don't preach what I don't do. Paul said for those of us who you that preach, do you do what you preach? Very important. So these are the exercises. Exercise 5 times a week. You cannot do 5 times. At least 3 times a week. Walking. We can easily walk around our houses. So you don't need to go and even register in the gym. You don't need to do that. Walking. Running. You can run around your house. And swim for those who are comfortable enough. Have a swimming pool in your house. You can go to the stadium wherever you can easily have access. Tennis court. Domestic walk. You see, domestic walk can also keep us on our toes. Jogging, biking, golf. Those for the high society. Dance. You did dance last year, like we said. You can dance. Every opportunity you have to dance. That's people are so tired. Even in the church, the music is going on. You are watching others that are dancing. Instead of you to dance your own dance. Climbing the stairs. We have houses that have staircases. Climb up and down is a form of exercise. So these are things that you do within the house, within your compound. So easily. Don't need to go elsewhere to make this happen. So please let's try and do what you have been told, because these are very, very tough. Then diet, no added salt. No added salt. So people have asked, what do I mean by no added salt? Are we saying we do not cook with salt again? No. Not saying so. We are saying the food that we cooked, not on your table, put salt. In fact, that table salt should be eliminated from the dining table. I went somewhere not too long ago. If you eat their food, you don't like to eat. Everything is saltless. I have to tell you, man, obesity, implying excessively fat, everyone in the abdomen, it is associated with stroke risk. Check your weight at least once every month. So when we talk about obesity, we use what we call the body mass index. That's like BMI. That is what means weight over height squared. You measure your weight and take your height. You can also do that if you have a weighing scale. Put the height scale on the wall, and you measure your height and weight. Normal weight is between 18.5 to 24.9. That is normal weight. Overweight is 25 to 29.9. Obesity is if your BMI gives you a value of more than 30. You'll be surprised some of us are overweight or obese because of our heart. So it's weight to height. You're not just looking at the human, you are okay. You know, a sedentary lifestyle, sitting disease. Like it's often preached, some of us we live in air-conditioned houses, air-conditioned offices, air condition cars, and there's no exercise whatsoever. Sitting disease, this can lead to weight gain. So as much as possible, avoid sitting down for a long period. Maybe after sitting down for some time, you can deliberately take a walk, deliberately. Then it is a misconception that being fat is a sign of wealth. You know that slogan some time ago. So it's a misconception that being fat is a sign of wealth. Eating a lot of fatty foods increases the chances of obesity. A lot of like a lot of oil, butter, bacon, all those fatty things. We are not saying we should not eat them, but like the word of God says, there should be nutrition, everything. Nutrition. You know yourself. You know what you should eat. You know what you should eat in moderation. You know what you should eat in excess. Next, so your income. A lot of us have high income jobs. So when we go to the supermarket, we are seeing a lot of beautiful things on the shelf. We want to buy them. We want to eat them. Your income should not change your eating habits. Eating fast food should be discouraged. You know, we are very careful to talk about that because we have a lot of eating joints all over the place. Of course, once in a while you can go there, but don't make it a habit. And you also spend a lot of money there to buy those things. So don't make it a habit because you have very high income, you can afford to do it. We are saying your income should not change your eating habits. You should not. You should eat healthy. Symptoms, yes, and just because spoke on it. What I want to emphasize there is the swelling. What are the things you notice when you have a stroke? Sudden weakness of the hand and the leg on one side of the body. The face will be involved, when the face is involved, that's when you hear people say, doctor, my mouth twists to one side. It's a sudden numbness or weakness of the face, leg, especially on one side of the body. Sudden confusion, trouble speaking. Like he also said, you've seen men of God, not even men of God, I was in a gathering. No, I was not in a gathering. It was a man that was in a gathering, speaking as the chairman of the gathering. I was in the hospital when they rushed in that man. Dressed in white, sparkling. He said, the story was that he was talking, the way I'm talking, and he slumped. And he rushed him to the hospital. This was a man who left home, passing, going to a place and location. See the word sudden. It does not announce itself. It's not like when your legs are swollen, you know, oh, something is wrong. This one does not announce, or you are feeling breathless, so something is wrong. It just comes suddenly. And they brought the patient to the hospital. And the church members, when they heard the whole truth, are beginning to do God and just allow them because in case he was in deep coma by the time he had arrived in the hospital. And we were praying. Then I was just a junior resident, and I sent for my senior doctor. But by the time I resumed work the following day, the man had passed on. What kind of stroke is that? Hemorrhagic stroke. There was a bleed in the brain. That's what I said earlier. If the vessel burst and the blood spilling all over the brain, can that person really survive? That was exactly what happened. So suddenly, he does not announce himself. That's why we must take this kind of lecture very seriously. Especially this practical aspect. To do the things we must do to prevent stroke. And everybody can with high blood pressure. High blood pressure. And if a male, it also said the male sex is also more at risk than the male and the women folk. Next slide, please. So suddenly severe headache. Patient can present, doctor, it was headache of my life. That's what we talk about subarachnoid hemorrhage. It was headache of my life. So if you are interested in this one, you may have a TIA or a mini stroke. If you think someone will be having a stroke, act fast and do the simple test. What is the simple test? Next time. This is the simple test. I think he also talked about it. This is what we can do at home. Especially for the ischemic type, not the hemorrhagic. This is for the ischemic type that is about 80 to 25 of people suffer from. You look at the face, ask the person to show his teeth. If the person shows his teeth and there's a deviation of the face to one side, the stroke probably would have taken place. Then ask the patient to raise both hands. Does one arm drift downwards? So it means this hand is weak. Did you know observe that? 10 minutes to show button. See, this one is dropping. It shows this is the weakened hand. Then speech. Ask the person to repeat a simple sentence. At the worst, Lord, can he or she repeat the sentence correctly? You are all hearing me clearly. But the patient that has a stroke, without his lost speech, you can't hear what he's saying or cannot even repeat that sentence. Then if the person shows any of these symptoms, time is important. Get to the hospital fast. Brain cells are dying. Next slide. We cannot emphasize that enough. Time is brain. Time is brain. That is the slogan for this year or the theme for this year. Saving precious time. Saving precious time. You heard him say a lot of people don't come to the hospital. People believe stroke not they know hospital. And that's slogan. Stroke not they know hospital. And in the Western world, they go to control-politic therapy. They didn't have time to really elaborate on that. And what God has done to little time. From when the patient had the stroke to when they put that therapy. Within 3 hours, if the patient will present to the hospital, that situation can be reversed for the ischemic time. That's when the vessel is blocked, not the hemorrhagic one. So this is time is brain. What are we saying here? See, minutes can save memories. So those are the things that are affected when the stroke occurs. Your memory, your mobility, your independence, your speech. All of these are compromised. And we are saying time is brain. Minutes in bringing that patient to the hospital can save the patient all of this. See, it is also represented there. They say when somebody has a stroke, every second that goes by is crucial. As brain tissue and millions of neurons begin to fade away, time could not be more precious. The Precious Time campaign continues to raise awareness about stroke symptoms and the importance of acting fast. The importance of acting fast. Once upon a time again, I was at home when I was called. It was one of the PS in the Ministry of Health that called me that said, my sister, please, I have a relative who just had a stroke. And it was a Friday. I don't run clinic on Fridays. I said, okay, I don't run clinic on Friday, but because of you, let them bring the patient to the hospital. So and so time when the clinic will be opened. I told my nurses to be on guard because the patient is coming. And they came. We were there, I evaluated the patient, and I said, let me admit the patient so that we start what we want to do. Then I said, okay, let them go and discuss. And I was waiting for the discussion. To tell you what is happening, call the woman who came with them that I know very well. So what is going on? I said, I don't know. They said they want to carry the patient go wherever they will, at least not the hospital. I said, why? This thing is beyond me, no, it's family. When family decides individual this thing. I don't know exactly what happened. Whatever became of that patient is not in our duty. I didn't follow up, and I don't know. But that's what most people do. I just give an example of one of us who also did that. Rather than coming to the hospital, they say we don't have to do therapy here. But whatever we do, the conservative management saves lives. It does. Where I trained, where I have some and posting in Lagos, University of Lagos, under Professor Damisi. In fact, the man was giving a name. Once the patient has a stroke, when Professor Damisi attends to that patient must come out walking perfectly with his 2 legs and his 2 hands moving. There's no community therapy there. The conservative manual, because the patient has come on time, and whatever we do can still go a long way. Can still go a long way. So don't say stroke not a no hospital. Even trust people like I said before. Members, there was one man sitting behind me and came. My wife had a stroke. I said, how long ago? He said 6 months. 6 months? You are coming 6 months later to tell me that your wife has a stroke? In this same church that this building that have disputed their time and time without money. Don't you know I've been talking about stroke? He said yes. Then what happened? Another sister the same way. Didn't you know I've been talking about stroke? I said yes. But we went out. What became of him? The same thing. And by the time they are coming back 6 months later or 1 year later, the hand that would have been straightening or even walking has developed stiffness, what we call contractions. that hand can no longer come down, move up, and become stiff. Whereas if the patient had presented on time to the hospital, that could have been avoided. And the patient probably would have hoped, yes, not just to recover, some recover fully, some partially, some not to recover at all. And you are around quickly, let that patient come to the hospital, be able to convince them that there's something the hospital can do. But that and that, what we are here for is prevention. We don't want anybody to have a stroke. Because stroke, we are told, is the commonest cause of severe disability. It disables. If it doesn't kill you, it will disable the person. We don't want that. Just another slide. Yes, go on, it's the same thing we are talking about. So what are we talking about here? The risk of stroke and other major vascular events can be reduced effectively by sustained blood pressure lowering, sustained blood lowering, optimal control of blood glucose, smoking cessation, increased activity, increased body weight, decreased salt and alcohol, increased fruits and vegetables. And I pray when you do all this, the good God will save all of us from stroke in Jesus' name.
Very much, man. I think that we can do lecture. So at this point, we'll take questions. We want to quickly recognize the presence of the head of department of the Dental Central Hospital, Benin City, Dr. Mrs. Rebecca Esezabo. You're welcome, ma'am. We also have a consultant pediatric surgeon in our midst. Please let's put our hands together for Dr. Aisen. All right, we also have in our midst the Reverend Gentleman, Resident Pastor, Church of God Mission International Faith Arena. So let's take your questions. What if I don't smoke cigar, I also smoke shisha? It's not shisha. You smoke Okay. I don't know, I need to take questions. I also want to recognize the presence of the head of department of the Department of Family Medicine, Dr. Musa, in the house. Please let's put our hands together for her and you ask your question.
I want to stand on existing articles. I am Asemuta. I want to start by thanking the presenters for this wonderful presentation. And I want to say that I've been listening to lectures, medical lectures like this. This one seems to be the one I enjoy the most. And I also want to say that I initially would have tagged this the most fearful lecture I ever heard. Then she started by saying to know is not to fear. So that one tells that. Then my question has to do with the role of stress in all of this. Stress, occupational stress, problems, you are thinking. Because we are talking about BP, we talked about other factors that will relate. But I want our guests to tell us the role of stress in all of this. Then secondly, the issue of smoking and drinking. Some people have formed it a habit, and when you try to correct them on it, they said that it helps them to control stress. Are you seeing what I'm trying to look at here? If stress contributes to this, and they said smoking and drinking help them to, relieve stress, then how do we reconcile that? That is the question. Then again, lastly, from the way we have looked at stroke, the way and BP is said to be one of the major high BP, let me put that high BP, one of the major contributing factors. Then I think, in my own opinion, we have centers that support other public health illnesses, like HIV, like even diabetes. Why is there nothing to support people that are prone or sufferers of high high BP, which is not of their own making. So I think, is it possible to do something to support those kind of persons? Then on the issue of check, BP check, the conductor said, the CCB said, when you are above 40 years, check once a year. And later on said more frequently, like everyday check. Would that be okay? That is my question.
Common protocol to be observed. Please, what I want to ask, how do we now deal with this family problem? Because I have seen, okay, I had this an auntie. She had this stroke while in the farm. Let's take her to the hospital. The family came and said, no, like we all know, hospital does not have the cure. How do we now fight this family? Because if you look at it, this family issue is one of the greatest problems of those that are having stroke. How do we fight it? Then another thing I want to find out, like if you go out now, like somebody told me, say, look, red wine is good for the heart. If you take more red wine, that it works on the heart and you will not have stroke. Is this true? Thank you.
Mine is more of a comment. I want to start by, sorry? My name is Dr. Neurologist. I'm a consultant family physician with the patient. I want to first start by thanking the presenter. It was a very lucid and exhaustive representation. And when I heard the president about it, I said I must try as much as possible to repair. And I really appreciate they talked about every aspect. I just want to say something because this condition is something that not only the neurologists manage, a lot of other people manage in private practice, and that they are everywhere. So and most times when they have this problem, especially in this part of the world, there is this belief that it's a diabolical thing. I mean, somebody must have done it, it's demonic and all that. And so they end up, even when they come to the hospital, at a point, they expect the very quick relief. When they are not getting that fast relief, they end up going to the native. Surprisingly, even as Chief said, even medical people also do it. So I want to talk about, most chronic diseases, apart from being, is a mixture of lifestyle and genetic. I wanted to make this more emphasis on family history and the family disposition of some of these conditions. Because you see, there are some persons who might never come down with this. Even some persons will come down with this, and so that now makes the basis of people feeling, oh, I came down with this. This must be due to maybe it's a spiritual thing, as they say in the that they throw something in me or something like that. So once you know you have a family predisposition for this condition, from the onset, you already have that. You start taking all these preventive measures and all that. You understand the chance of getting it. So when you eventually get it, you are not quick to believing that. That look, there was a predisposition, so I got it because maybe I didn't. My lifestyle was faulty and all that. So I think that family aspect, family history, and predisposition is very important in most of these chronic diseases. That might give reasons why some will eventually have it and some will not. And then there's this other thing about taking antiplatelets, maybe like aspirin from the age of 40 and all that. A lot of people, they don't need to come to hospital. They have that, most of them, they have the knowledge, they do it. So also I think maybe we'll also throw more light on that. And then there's this other antiplatelets, Bluetoolz for those ones who have ulcers. So I think the speaker will throw more light on that too. Thank you very much.
My name is Charles Omo from the Office of Medical. Please, the issue of not adding salt on the table. I want them to elaborate on the danger with that.
Come again.
That is not adding salt on the table. I want them to elaborate on the danger of doing that.
Joy, Ayo. My question is, if the blood pressure is normal, can one still take the drug? Maybe the first day, second day, third day. You know, we have this machine we used to check blood pressure at home. You check it the first day is normal, the second day is normal. Is it okay to take the drugs?
I'll start with the last. That's a very important question. If your blood pressure is normal, do we still need to take the drugs? You know, when I was trying to emphasize that we must take our drugs. That's what a lot of patients do. Once they have their BP instrument at home, they take it, it's normal, they stop drug. And I said, no. It is the drug that keeps the blood pressure at that normal level. Please take note of that. The drugs keep the blood pressure at that normal level. That is why when you stop, the blood pressure begins to go up. For one reason or the other, you are hypertensive. There's what's called essential hypertension. But we don't know, 95% of cases, we don't know why there's blood pressure. Like 5 or 10% we know there is a cause. So we don't know, but BP is already really high BP. You take your blood pressure, first day is normal, second day is normal, it means your blood pressure is controlled. That's what we call controlled blood pressure. So don't stop taking your drug, because if you stop, the blood pressure is going to go up again. That's why it's like, take your drug, don't make your BP, it goes up, you take it goes down, you stop. No. Please stop taking, continue taking your drugs. And that's why you must maintain regular clinic visits, so that the doctor can decide when to reduce the drug or when to say, no, this is the number of drugs that will control you to continue. Then the issue of aspirin, thank you for bringing that up. A lot of people have aspirin. This is where we neurologists have issues with cardiologists. I don't know if there are any cardiologists here now. A lot of cardiologists will tell patients to take aspirin. A lot of patients are soluble. I'm hearing my voice. A lot of people are soluble aspirin. We neurologists don't just put people on soluble aspirin. Hello? It's only when you have had a stroke. That's what we call secondary prevention. We only put people on aspirin when they have had a stroke. If you have not had a stroke, we don't advise you go on aspirin. But if you have aspirin, be ready to take aspirin all the days of your life. Just like we are saying, take your drug every day. And you mentioned clopidogrel and also those of us when you make me feel. I, as a neurologist, do not prescribe clopidogrel except you have any reason not to take soluble aspirin. Soluble aspirin is available, it is cheap compared to clopidogrel. You understand what I'm saying? Yes. You don't just go just taking soluble aspirin, and that is one of the things I was trying to say. When another person will tell you, take this one. A lot of people have told other people go on soluble aspirin. That's not the reason the doctor prescribes it, not because of your blood pressure. When you're asking people what are you taking for blood pressure, they say soluble aspirin. Soluble aspirin is not for blood pressure. It is not for blood pressure. It is for your vessel to be clean of whatever wants to block it. It is not for blood pressure. I cannot say that enough. Thank you. Dr. Suro.
We all think, and I always tell people that the mistakes that causes blood pressure, all the doctors and all the lawyers, they will have all had blood pressure. So it's not thinking that causes blood pressure. We are seeing the things that can make somebody have blood pressure, as we saw in the discussion today. And one of them is increased salt intake. Salt increases blood pressure, it increases your blood volume, and that can raise your blood pressure. So that is the rationale for asking that your salt intake should be reduced. There should not be added salt. Once you have prepared your food or your meal with salt and it's tasty enough, to now be adding salt upon eating that meal on the table is causing extra or adding extra salt, and that can amount to creating health damage to an individual. There's a limit to which salt should be to the food you prepare, and usually recommend nothing more than 2 grams of sodium chloride, salt, table salt, and that is like a level a tablespoon. So that should be enough for what you prepare as your meal every day. You understand? So it is not stress that or thinking that causes blood pressure, hypertension rather. It is not. Then for the issue of stress is normal, it's good for humans. And it's when the stress becomes abnormal, that is when it's a problem. When it is now resulting to distress. You understand? So we need some level of stress to be active, because what actually brings the stress out in us, or what makes it look like we are stressed, is when some of those anti-hormones are into play. Hormones like cortisol, hormones like adrenaline. You know, for instance, now if the lion comes here now, you will not look back before you jump. That is a stress on its own. So, and that action will make your heart to start racing. That action will make your breathing to start, increasing. So that is good to some extent, and that is the reason why we advocate exercise. Because when you do that, you put your heart to work, you put your lungs to work, something that ordinarily would have just been working slowly, like somebody that is sick. When you exercise, you put that to work. The breathing in, breathing out exercises you do cleanses your lung, removes what would have been something that would have been hanging there to probably come out in the air, like that. So the same thing applies to making your, when your heart starts, working, racing beyond the normal level, and that also, creates some level of exercise on the heart on its own. So stress to some extent is good for our well-being. You understand? Then if we talk about the relationship between alcohol, smoking, and stress, and some people use alcohol or drink alcohol to ease stress. You understand? People who originally designed all those things or produce those things, produce alcohol, produce cigarettes, they make those things with some level of, some constituents of pharmaceutical products that they have some activity on the heart. I heard people talk about drinking caffeinated drinks to kickstart the heart, or drinking or smoking, because smoking has caffeine to kickstart your day, things like that. But over time, studies have shown that even though there may be some benefits or some beneficial pharmaceutical or pharmacological agents in all these things, but there are also some harmful agents in addition. And as a matter of fact, the harmful agents in them outweigh the beneficial ones. And it is those harmful ones that trigger some of all these problems. So the bottom line is that it is better to avoid it than to indulge in them. You understand? Then the other question talks about why is there no hypertensive support the same way we have diabetes support? Well, there are agencies or bodies, especially NGOs, that give support to hypertensive patients. Some people give SFI, like all these digital SFI, free of charge to patients. There are agencies that does that. Just the same way people support diabetes by giving them the Colita. You understand? So we may not know them, but they are there, especially pharmaceutical companies. They are also there like diabetes. So the same way people advocate people to check their blood sugar, stuff like diabetes, that's also how hypertensive doctors who work or treat hypertensive patients are also advocating for people not to be hypertensive. So there are also support in one way or the other for patients who do have hypertension, the same way diabetics are also supported. Maybe it's only diabetics you see, because I know you may know that there is diabetes support program here in Central, but there are also hypertensive support. Then they said how do we deal with family ideas about stroke management? And we cited examples like our mama talked about the instances of somebody who has stroke and then brought the patient only for the family to go and decide and say, no, we no longer want hospital care, we are going somewhere else. So family will always come with their own ideas and decisions. Sometimes it might be financial issue. At other times it might be awareness issue. And it's a level of awareness, especially when they saw somebody who used a traditional healer and escaped from the complications and got well. You understand? Some people may suffer a stroke and may not go anywhere and just still resolve, like we talk about transient ischemic attack. Sometimes when such an individual went to a traditional person and they don't apply one or two things and the thing resolved, you say, the man, you did it well. And then another person will suffer, say, that is where we took that man to that day. Let's go and use it. Not knowing what probably has caused this one stroke. You understand? And not also knowing what type of stroke this one had. And one may have a hemorrhagic stroke and come unconscious. Another one may have a ischemic stroke and just come with facial dilation. Another one may have a ischemic stroke and come with facial dilation and arm and limb weakness, lower limb weakness. You understand? So we may not want to use the same.
Good afternoon, ladies and gentlemen. Good afternoon, members of the active. Standing on the existing protocol. On behalf of the Abo-EEASAF Ekhator Stroke Awareness Foundation, we want to say we are very grateful to all invitees who created time, precious time, to be with us in this Stroke Awareness Day for the World Stroke Day of 2021. We want to particularly thank the former immediate past commissioner of health, Dr. Patrick Okoye, for finding our time to come to honor us. We also thank the immediate past medical director of Central Hospital, Dr. Moses Imongome. We also want to thank the present medical director of Central Hospital, Benin, Dr. Duncan Iyawe, for finding our time. He came very early and he stayed with us throughout. For those that were also here, and for one reason or the other, maybe they want to honor another invitation, they've left us. We also want to say thank you very much. Also, we want to thank our amiable speaker, Dr. Osumbo, for the wonderful lecture he gave us. We also want to thank our mama for putting everything together today, because like the ND chairman said initially, it's not easy to put these things together and have this kind of crowd here for today. We want to say thank you, ma'am. Not to say the least, every other person that found time to be here with us, you all are very wonderful. We want to say thank you. As we leave here today, we ask that the Lord will guide us safely to our various destinations. I also want to use this opportunity to inform you that immediately after this section of the program, we'll be doing an outreach where the blood pressures and possibly the blood sugar of people who may volunteer to have it checked will be checked. There will also be an avenue for you to check your eyes. Once again, on behalf of the Abo-EEASAF Ekhator Stroke Awareness Foundation, we say thank you very much.
Thank you so much, sir. We will now call on our immediate past Commissioner of Health, Dr. Patrick Okoye, to give the closing remarks. Sir.
Just say, inside knowledge is power. I like that here again. I also like that I said, to know is not to fear. On that note, I want to say a big appreciation to our colleague and our mama, Dr. Edith Kayode-Iyasere, for once again bringing before us the knowledge of our stroke. most important thing about what happened today is that she's been able to sustain this measure for about 3 years now. Under the ABO Foundation. I can't tell you much appreciation, but just a people word of prayer that God will give you the strength and the enablement to continue to carry this on and to sustain it for more years to come. We can never exhaust information dissemination to our people. It's not those that come to the clinics and we give prescriptions that we have done any favor to, but those that we are informing about how to prevent these diseases. I have no doubts that at the end of this event, the knowledge that has come out from our resource persons and from the interactions I've had will go a long way in helping to prevent stroke amongst us, and maybe globally to reduce it from 1 in 4 to 1 in 10 by next year. It's a prayer that God will answer us. I also felt that these lectures and the quality of lectures that came out here this afternoon should have been shared with CME credit units. But I think it's not too late. The leadership of PROD and MDCAN can actually work on this for the members that are in attendance to earn some CME units for these lectures this afternoon. Talking to us, there are a lot of health workers here and non-health workers that are invited. But I think we should take some of this to even larger audience. On that note, I will sponsor media coverage of this. This video should be put in an ITV at least for the general population to learn 1 or 2 things. I will not add more to what has been said so far, but it's a prayer that the many aspects of this whole week and the aspects of the Abo Foundation. Pray that God will lead you to successful completion. And I want to wish all that attended this event this afternoon the blessings of God, that God will take us to our various destinations. Thank you and God bless you.
Thank you very much. So please can we rise on our feet?
Like the this game or not? It's already but you can do it. Your sugar test this side. Your sugar test this side. After your sugar test, come and sit down with you.
Come this way. The doctor don't want to get here. Bring you are well, you are okay.
Yeah.
Okay, madam, when I saw you, bye-bye. I'll be back now.
I bet you smoking. If you are let her come to me. But we're here, let them go.
Ordinarily, I'm 10 minutes, but then if possible,
just read the one you can.
Now we have reached the boy.
What are the dots? Read this one. Thank you, sir. Next person.
Give us your full name, sir, and your details, sir.
Can I?
Yes, you can.
Is it okay?
Yeah, it's okay, sir. Your full names and your details, sir.
Okay. I'm Dr. Duncan Yahweh, consultant pathologist, the medical director of Central Hospital University, representing the permanent secretary, chief executive hospital management board at this event.
Sir, so what do you have to say concerning the event of today, sir?
Well, today is a World Stroke Day, and this event was planned and carried out to raise awareness concerning stroke in our community, in our society. As you heard from the lecture that was given, stroke is a preventable disease, and the statistics we got is quite alarming that 1 in 4 to 6 persons are likely at the risk of having a stroke. And we have also been taught clearly that stroke is not the way we see it. There's actually a brain attack. So all in all of us are benefited, and it was a well-organized event today.
Thank you.
Well, my name is Ekhator. I'm a staff of Hospital Management Board. So I'm here for the program, for the free checkup of BP and a free sugar level test. The sugar level test is free. The checking of BP is free, and the last and not the least, which is the eye, this is also free. So I'm here in regard of that, so that I can have my eye checked and my sugar level and so on.
So what do you want to tell the people organizing this event?
Well, I just want to use this medium to appreciate them and to say kudos to them. They have really done well. If they can extend it to other areas, so that the people will have more awareness of it. So they should extend hands of fellowship to other areas.
Okay. Some of the resource person.
I'm Dr. Osumbo Osareme Augustine.
Dr.
Osumbo Osareme Augustine.
Okay.
And I'm a consultant physician in Edo State Hospital Management Board.
Okay. So one of the resource persons, so how would you find this event today?
The subject for today was quite hard. It's an awareness program to mark this year's World Stroke Day, which is usually celebrated on the 29th day of every October. That of this year happens to hold today.
So what do you want to say concerning the event generally? The people that attended, the organizers of the event, all of that?
Yes, the event was quite a huge success, and the attendance was quite impressive. And even all those who came very promptly. And the attendee cuts across both medical and even non-medical persons. That's quite commendable, because the bottom line is to create an awareness about the disease of stroke amongst our populace.
So thank you, and who are you, sir?
I am Mr. Asemota Edwin. I'm a Chief Scientific Officer. I work as IPC focal person with Central Hospital, Benin City. I want to say that today's lecture is remarkable, and it was organized by ABO and the Chief Consultant to the board in collaboration with Hospital Management Board. To say that the lecture is apt is an understatement. I want to advocate and canvass that this lecture should be taken to the communities. Let family members know about it, because people will try to mystify stroke, and here they have demystified it that stroke is not a spiritual matter. And like many people thinking it is the leg, it is the mouth, it is the different parts of the body, that stroke is an attack on the brain. So whatever you are doing to try to ameliorate issue of stroke, trying to bend back the leg or do one thing or the other to the leg or maybe the hand or all those things, you are just wasting your effort. And again, that stroke is treatable and it's also preventable. Knowing that alone gave me a lot of hope. But I want to say that it also prior on my ignorance, because I never knew that salt is as dangerous as it was. Until today they said, you don't add a pinch of salt to what has been cooked for you. To me, that one is a life jacket that has been given to me, because I'm one of those who love something sweet, salt. But from today, I think I've taken a step that we must prevent stroke before it happens. And they also taught us about the two types of stroke. And the most dangerous one that is irreversible is when there is a rupture in the brain. That one is irreversible. But before we get all to all that, the body gives you a lot of signs, which we must be sensitive to those signs that the body is giving. And there was an acronym that they gave. The acronym was FAST, F-A-S-T. That the F means when you notice something in your face is a kind of paralysis in the face. Then the A talks about the arm, when you notice a weakening in your arms. Then the X, then your speech, you are not able to talk the way you used to talk. Then the T, then you know that time is not on your side. You must rush quickly as much as possible to a medical facility where you can get attention. There was one issue that was burning, the issue of the role of the family when it comes to the issue of stroke. And most of the time, people that are down with stroke can no longer decide for themselves what happens to them. So the family decide for them, and most of the time the steps they take are the very wrongest step that leads to the death. So I want to advocate if it is possible that everyone should have a red card, which is a medical card in your purse, where you can write, if I experience stroke, take me to the hospital. If I experience stroke, take me to the hospital. Just like you write your blood group. For example, you are in a situation where you cannot speak for yourself. Instead of somebody speaking for you and taking decision to take you to a traditional home where they will worsen your case, right there, if I have stroke, take me to the hospital.
Receive this lecture, we'll go out there and put them into practice and also educate others. Thank you very much.
Go on.
Dr. Edith Kayode-Iyasere is my name. Consultant physician neurologist with the Central Hospital, Benin City. Also the Chief Consultant Board, Director of Clinical Services, Hospital Management Board, Edo State. I am the chairperson of the Elizabeth Ekhator Stroke Awareness Foundation. This year, we are joining the World Stroke Organization again to celebrate the World Stroke Day, which is every October 29th. So we are in this hall giving lectures on stroke,
giving lectures on what the people must do to avoid stroke. We are focused on the risk factors because we know when we as individuals take care of these risk factors, stroke is preventable. But our theme for this year, according to the World Stroke Organization, is saving precious time. And what do we understand by saving precious time? It means when a person has stroke, every minute is important. Every minute is important. That patient must quickly be brought to the hospital so that we can salvage the brain cells that are not affected. But the more we wait for that intervention to take place, the more brain cells are dying and the more the stroke worsens. So that is what saving precious time is involved. In popular parlance, we say time is brain. Time is brain, and in the Western world, we say quickly call 911. But here we are saying the relatives, the loved ones can help the stroke patient come quickly to the hospital. It's not about stroke does not know hospital, because that is what the people believe. Stroke does not know injection. We are saying no, that is not true. That is a myth, and there's no reality in that. What is true is that when we bring that patient to the hospital very quickly, whatever is done for that patient in the hospital can help reduce the burden of stroke. So this is what this stroke awareness is all about. And the Augustine, Bonaventure, Omorogbee-Elizabeth Ekhator and Stroke Awareness Foundation is saying to you, don't be the one to be affected by stroke. Take care of yourself, do the preventable things, and stroke will be far away from you. Thank you very much.